Hello everybody, I am Dr. N. Chandrashekar, Senior Consultant Neurosurgeon at Sakra World Hospital. Stroke is a condition where person develops weakness of one-sided limbs, which is due to the stoppage of blood supply to the brain, due to which the brain cells get damaged and cells die and causing disability and the morbidities. Okay, why does it happen? So usually it happens because two types are there. One is ischemic stroke, we say, and hemorrhagic stroke. So ischemic stroke is loss of blood supply and cell damage, and this can happen because of the clots in the vessels supplying the brain, or clots coming from LSA, example from cardiac problems. The hemorrhagic infarction is one wherein there is a bleeding the brain tissue, and that causes mass effect on the brain cells and causing damage and disabilities. So ischemic stroke can be treated if they come in type, example around within 3 to 4 hours. They are called IV TPA, tissue plasminogen activator. This is given to establish the blood flow and thereby causing further damage to the cells and making the patient improve in his lifestyle and prevent disability and morbidity. So the hemorrhage can be either because of the subart hemorrhage, what we say, which happens around the brain, and there is intracellular hemorrhage. So both either intracellular hemorrhage can be treated with surgical evacuation, and aneurysm can be done with endovascular treatment like clipping, with coiling, and clipping also can be done. So who are at risk? So the people of younger group, younger age and older age also are affected. Men are more affected than female, and more so in the older age group like 55 plus age. So the causes, the risk factors in these are diabetes, hypertension, excessive alcohol consumption, cigarette smoking, physically inactive, obesity and drug abuse, cardiovascular problems, or persons having a family history of stroke and cardiac ailments. So how do you prevent this? So best is to prevent, to avoid smoking, drinking alcohol excessively, so do everyday exercise, and daily change in our daily life activities. So how do you diagnose this? So there is examination wise, you look for, there is called as FAST test. So F stands for face. So look at the face and ask the person to smile. And if you feel there is a drooping of one side of the face, or there is a crookedness of the face, that's one of the indications that the patient has got weakness. Second thing, ask the patient to lift up the arm. If he is able to hold it like that means it's normal. Otherwise, you will see one side of the limb falling down the others. So that indicates there's a weakness of one side of the limb. And next is speech. So the fluency of the speech. He may be either not able to speak or he may be have stuttered speech. So this is the indication that patient has got stroke and it's time to immediately rush to the hospital to get immediate treatment. So time is life, time is break. So that's how it is. So stroke is a preventable and curable condition if they can come within 3 to 4 hours and get the immediate treatment.